Okay, welcome. I've got a short standing practice for you today. We're going to explore the relationship between your feet and ankles, your knees and your hips. And to do that, we're going to be using a little bit of wall. Could be a door, even as long as that door shuts and remains shut. It's not going to fall open behind you during the practice. Ideally, you're going to have a space, though, that's just a little bit wider than your body. If you have a yoga block, grab it. If you don't have a yoga block, a rectangular tissue box, especially one that's full, or a Tupperware container that's about this size, or a cardboard box that's about this size would work well. Or you could even use a folded up or rolled up blanket that's about this size. There's lots of things you could use instead of a yoga block. You're also going to grab a small ball. So this is a rubber ball from Yoga Tune-Up. It does not have to be this ball. So you could use another self-massage type ball. You could use a tennis ball or anything similar in size to this. You could even grab a pair of thick socks and ball them up one inside the other and use that. Okay, so grab those items if you need to. We're going to place them aside though for a moment. And we're going to bring the back of your body onto the wall and step your feet a foot or a foot and a half in front of the wall. So as you're settling in here, you're going to notice somewhere around the back of your hips is probably on the wall, and somewhere in your upper back is probably on your wall. And then if you relax here a little bit, it's very possible that your head or shoulders and or maybe your mid to lower back area is not on the wall, and that's fine. So I'd rather that we not put tension into the body to try to get those areas back. And your lower back has a curve in this direction away from the wall. So there's no need to flatten that out. Allow that to be there as much as feels natural for you. Okay? You might notice a little bit of space here between my feet as well. Okay? So the first movement we're going to do is just to kind of check in with your body and what you feel in your body. And the movement will be, you're going to bend at the hips, knees, and ankles as you slide your body down the wall. And back up to stand. Now, how far you slide down is going to depend on what you feel. So if you have symptoms, pain, ache, extra grippy tension, anything like that starts to happen as you do this movement, I want you to try to make the movement smaller so that those things do not start to increase, okay? Now, I know if you have persistent ongoing pain in some of these joints, you might be really used to pushing through them and you might think, oh, that's fine. And actually, that may very well be true. I want you to move in a range where you're not increasing your pain, not because I think the pain indicates anything bad or harmful that you're doing, but just because we're going to work in a zone here where your pain is not coming up so that we can increase your body's familiarity with these movements in a way that feels really safe and comfortable for you. Okay, so this movement is your check-in movement. We're going to come back to this a few times. See if you can find a range that is not increasing your pain. Check in with how that feels, and then notice, do your legs feel strong or kind of shaky? Do you feel grounded on the whole of your foot, or does something happen at your foot and ankle as you're coming up and down? Are your toes flapping? Do you have symptoms that are coming up? Are you wanting to flatten your low back or lean to one side, or is your body from your pelvis to your head sliding up and down like an elevator? So you're just checking in to see what's happening with this movement. And then the first thing we're going to try is we're going to take this block and we're going to place it between your legs. Now, some people are comfortable placing it between the legs a little higher up. Some people, it really just feels more comfortable for your body having it a little bit lower down. Okay. Some of you are going to find that this object that you have isn't the best object for you. So that's fine. See if you can find something that fits there and feels relatively comfortable. And we actually don't want to be squeezing in on this block. We just want it to be able to be there, okay? And then you're going to do the same movement again. And what we're looking for is whether this block sensation remains constant between your legs Or does it feel like you need to squeeze it as you come up and down? Or does it feel like you're going to drop it as you come up and down? So this is just giving you a little more awareness of what your thigh bones are doing as you're moving up and down the wall, right? And then as you have this block here, if you had symptoms that were coming up before or grippy type sensations or anything like that, your toes were flapping around, your feet were rocking, anything like that, notice if it's different when you're moving with this block or other object between your legs. And so you're just going to notice what changes. Sometimes nothing changes, and I will say human brains tend to prefer to see change happen. But even if change didn't happen, that's useful information. So as much as you can, just notice and be curious, with kind curiosity as to what is going on here as you're moving. Okay. So we'll put that block aside. The next thing we're going to do is do a little massage for the bottoms of the feet. So you're going to take that ball underneath either foot, and you're just going to roll it lengthways along the arch of the foot. Now, you might have some discomfort there. Okay? This is not self-torture, so be gentle. But we're just going to do a little massage here. So sometimes when we have pain further up, we discover that the feet are actually pretty tight as well. So you can also go side to side across the arch. And there's more we could add here, but we're just going to do these two movements, lengthways along the arch and side to side along the arch, towards the front and towards the back of the foot. And then you can come to stand and just notice if the two sides feel different. And you might notice the feet feel different. You might also notice that things feel different further up. So pay attention to the whole body here. And then we're going to come into that second foot. I'm going to roll lengthways along the arch. Now you're standing here, you get to choose how much pressure you want to put into the foot. And it's fine to lean on the wall or hold onto a chair or something else if that's helpful for balance. So this really isn't about balance. We're just giving a little stimulation to the bottoms of the feet. Go side to side if that works for you. Sometimes that can be a little challenging. But if you're able to go side to side across the arch, you can do that as well. Getting towards the back of the arch as well as towards the ball of the foot. And then we're going to move that ball to the side for now. Bring the feet back into position for that wall sit. And then we're going to come back down again. Now you can do this with the block or without the block. I'm choosing without the block. So I want to see if this is different than it was the first time. So just checking in with your range of motion. Do those symptoms of pain and grippiness come up in the same place, or has something shifted? Do you feel more stable or less stable? Sometimes we feel less stable. We don't prefer that, but it tells us something important about what has changed as a result of what we did. Okay? Still useful to know. So you're going to come up and down a few times, check that out, see if anything feels different. And then we're going to turn sideways to the wall. You're going to grab your block again. So I'm going to stand first on my left foot. I'm going to bring this block onto the wall and then next to my right hip. And then I'm going to step my left foot just even a little bit further away from the wall. So you may even want a hand on the wall as you get into this. You're going to bring your right leg up towards a right angle. And then you're going to pin the block between your upper right thigh and the wall. You might already feel something going on in your left hip, maybe not. Okay. So I'm just having my right leg here, and then I'm going to press the left foot like I'm trying to slide it out to the left. And I'm going to press my right hip into the block, into the wall. And I'm just going to hold that work. So you might find some sensations are happening of work. We do want to keep this in an amount of work where you're not getting an increase in symptoms. You might feel some effort, but we want to be able to stay fairly relaxed and sustained here. And there shouldn't be pain starting to happen in the joints or anything like that. So if this is not the best movement for you, you're going to skip it. And then after we've held it for a while, we're going to release, stand. You may notice again that things feel really different side to side as you come out of that. We are going to do the other leg for that reason. So now I have my left hip towards the wall. I'm going to bring the block between the left hip and the wall just for spacing. And I'm going to step my right foot like even a little bit further out. And then I'm going to use a hand on the wall for balance. As I start to lift my left leg, I'm going to bring the block between my upper thigh and the wall. And then I'm pressing the right foot into the floor and like I'm trying to slide it out to the right to send my left hip into that block. And I'm just going to sustain here. So again, paying attention to symptoms, first and foremost, and then seeing if I can keep this not so grippy. So relax where you can relax. There's definitely work potentially happening somewhere in this right leg or hip. Just kind of notice what you notice. Breathing nice and easy. And then when you're ready, you're going to release carefully. You can use the wall for support as you come out. You can either keep that block and use it between your legs as you come into another wall sit, or you can let it go. After you stand and observe for a moment, you'll come back into this original wall sit position as close as you can get. And now you're going to slide down and slide up again. And you're just going to notice, does anything feel different now? Maybe it does, maybe it doesn't. Maybe it actually feels less stable, so that's quite common as we start to change up your body's strategies of movement. The movement might actually feel temporarily not as strong because your body is having to figure out and rewire the way that it does the movement for the new situation in your body. And so that can be interesting as well. See if you can just notice without judgment to the extent that that's humanly possible, right? Which sometimes it is not. And just notice what's going on. And then you might just come and stand too away from the wall. Notice what seems different as you come to stand. And feel free to continue to explore this. So there's lots of other things that we can do that can affect how this movement feels, how your joints might feel as you come in and out, how your connection to the floor feels as you're moving, as well as your connection to the wall. If you noticed anything interesting, I'd love to hear about it in the comments, and feel free to ask your questions there as well. I hope you enjoyed this video, and have fun exploring your feet, your ankles, your knees, and your hips.